When we really use a lot of tooth bonding, especially when with kids, a lot of times we'll use it. So sometimes they might have a tooth that comes in their front that's smaller than it should be. So I'll work in conjunction with the orthodontist. They create the space, take everything off. I kind of bond it in, knowing that later on we might do something more permanent like a veneer or a crown. But ultimately, I really don't like placing crowns on kids until they're at least 18 to 21, just because at that age, before that age, teeth are still erupting. They're still moving. So when you place a crown or a veneer on a child that's younger than that, it's going to potentially change to where all of a sudden now they're going to end up having it replaced sooner than they otherwise would. But with bonding, you know, it's a lot of times it's an immediate fix, so that someone just fell or got hit with something and they snapped part of their tooth off. You can do some bonding, and a lot of times that can be a permanent, semi-permanent restoration. And a lot of that depends on how big the chip was, how much of the tooth was missing, what that particular patient uses their teeth for, whether they use them to open bags with, or like a lot of Doritos and beef jerky. Bondings don't tend to work as well, but as far as closing spaces in between, especially when spaces are minimal, it's a nice conservative way to make teeth look more aesthetically pleasing, create curves, close spaces, increase contour. And so many times that's the way to go instead of doing something more involved like a veneer. And when that usually tends to be the case is when the shade of the tooth is already, it's nice. So in other words, we're not trying to alter the color. We're just trying to close some spaces and recontour. Then bondings work nicely.